7 more common human medications that are safe and effective for cats. Number 1, the anti-vomiting drug, Gravol. Gravol or dimenhydrinate, it's a very safe drug and I used it a lot in practice. These Gravol tablets here, they're 50 milligram tablets. A standard cat dose is 12.5 milligrams or a quarter of one of this 50 milligram tablet given 2 to 3 times a day. Number 2, the active ingredient found in this Clear Eyes is called naphthozoline. That can be really effective for our cats that have red eyes. If your cat has red eyes or conjunctivitis from the cat flu, these Clear Eyes would be a great option. You're putting 1 to 2 drops into the affected eye. You're doing that 4 times a day for 5 to 7 days. Number 3, this is the stool softener. This is Restoralax. It's also sold in the US called Miralax. It works really well for our cats. It's an osmotic diuretic, so actually would draw fluid into the colon, so actually softens the stool. The other really important thing about this product is it comes as a powder form. You can see it there. You can sprinkle it onto your cat's food. It has no odor, it has no taste. So most cats take this really well. A standard cat dose of the Miralax, it's an 1/8 to 1/4 of a teaspoon, given every 24 to 12 hours. Marie's on the bigger side. I'd be inclined to dose them with 1/4 of a teaspoon once a day. And I can speak from personal experience, this stuff works really well. Generally see results in about 12 hours. Number 4, this is to induce vomiting in case of a poisoning. This is hydrogen peroxide. I've used this a lot in practice, and especially with our cats. It's difficult to get cats to vomit. Let's just say you've seen your cat just consume something seriously toxic. Say someone has Rimadyl for their large dog. Their cat Murray just ate 3 of the Rimadyl tablets. You call your veterinarian on emergency. The emergency vet would say induce vomiting as soon as possible if you can't rush in and get to the vet hospital. You need to be able to induce vomiting in that situation. A standard dose of the peroxide is about 1 teaspoon. That's this much here. Typical cat dose is about 5 mils. That's 1 teaspoon per 10 pounds of body weight. You'd give 1 dose, you'd wait 10 minutes. If your cat didn't vomit, then you'd repeat it. It needs to be the 3% hydrogen peroxide, and I also encourage you to have a syringe on hand. So draw it up into the syringe, and then get it into your cat that way. Using a syringe, it's a lot easier to administer it to your cat. Number 5, for hairballs and wounds, Vaseline. Your cat's intermittent vomiting, you suspect a hairball. You can put 1/4 of an inch on the end of your finger, give that to your cat twice a day. Most of the time you're going to see that hairball pass 2 to 3 days. You can also use the Vaseline topically. Your cat has a wound, you want to protect that wound, speed up wound healing. If you have nothing else to put on topically, consider Vaseline. Great option. Number 6, for cats that have nasal congestion, i.e. from the cat flu, Otrivin is a good option. We used to use this Otrivin so often at the shelter. We have these little kittens in, we'd have an outbreak of the cat flu, and they were so congested, had such a difficult time breathing. This stuff worked really well. You're just tilting your cat's head back, right? We're not gonna do it, Murray. You're putting 1 drop in each nostril. You're doing that twice a day, as needed till at least the congestion clears up. Then number 7, this new antihistamine, cetirizine, sold under the brand name Reactine. It's a really good option. It comes as 10 milligram tablets. They're here. A typical cat dose is half a tablet or 5 milligrams, given once every 24 hours. Thanks so much for watching this edition on Veterinary Secrets of 7 more over-the-counter remedies that are safe and effective for our cats. Click up there to subscribe, hit the bell icon for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book.